Head O, Ministry of Health, Dr. Tan Wu Meng.
Mr. Chairman, I beg to move that the total sum to be allocated for Head O of the estimates be reduced by $100. I declare that I'm a medical doctor in a public hospital. Sir, in the budget debate, I spoke about preparing for the next pandemic. Today, I will speak on delivering healthcare to our fellow Singaporeans and supporting our sisters and brothers working on the healthcare front line. I'll speak on 5 areas today: seniors' access to care, care coordination, caregivers, IT and design in healthcare, and our healthcare frontliners. Sir, on seniors' mobility and access to care. In an aging society, we have more Singaporeans with mobility needs. Some stay in older flats with multiple steps at the doorway. Flats where the steps are too high for the usual ease program organized by HDB. Has MOH studied whether seniors in such households are more likely to miss medical appointments? Has MOH looked at how to better support such seniors so they can more easily get to clinic, so that chronic diseases can be brought under control better, so that hospital admissions can be reduced by going upstream? And can MOH look into better support for home delivery of medications? Because this too will reduce the need for seniors with limited mobility to make multiple outpatient trips. Sir, my second point on care coordinators. On my Clementi home visits, I've met seniors who have many medical appointments. One old lady told me she has 10 medical appointments in the upcoming next 3 months. Each of them will mean her daughter has to take time off from work to accompany her to and from the clinic, from the appointment. With an aging population, shrinking family sizes, this poses a challenge for many seniors in the community. In some cases, the son or daughter can't take leave or has used up all of their annual leave. Or the family member may be a low-wage worker, daily rated, which means time away from work becomes loss of income. Many patients today are older with more medical conditions, more complex medical conditions, sometimes 3, 4, 5, even more medical teams looking after the same patient. Sir, there's a role for more patient navigators, more care coordinators, linking up across different care teams to help coordinate the care better, to help reduce the multiplication of medical appointments, to help make it easier for appointments to be brought onto the same day where possible. And we can look at reimagining our healthcare so as to support this better. Sir, I'm told that IMH has a team of patient care coordinators, and over the years, their experience has been this reduced the number of patients needing admission. There are lessons we can learn for coordinating care across other medical conditions as well. Sir, my third point on supporting caregivers. Some years ago, as a young doctor, I looked after an old lady with advanced cancer. She was very sick, not getting better. Her 50-year-old son quit his job to look after her. He quit his job to look after his mother. Later, she passed away. Her son's duty was done, but he had a lot of difficulty. He found it so hard getting back into the workforce in his 50s. Yet this man, this filial caring son, had shown dedication and devotion to duty. Day and night, looking after his mother, who was terminally ill. Dedication, devotion, duty. But unfortunately, potential employers didn't see it that way. They asked him, "What's this gap on your CV? Why were you out of the workforce?" They didn't see the dedication and devotion to duty. Sir, I call upon MOH to work with MSF and MOM to look at how we can better support caregivers, both during the journey of caregiving and especially when a caregiver is trying to get back into the workforce. Together, across the ministries, together with industry and with our brothers and sisters in the unions, we can find ways to build awareness among employers and even go the extra mile to recognize inclusive employers who hire fellow Singaporeans who are returning to the workforce, having spent time as caregivers, showing that dedication and devotion to duty. Sir, my fourth point on IT and design in healthcare. Chairman, when we empower our healthcare workers, when we look at what's happening on the ground and empower workers on the ground to do their jobs better, it helps patients as well. It improves the quality of care. It improves the patient experience. Sir, information technology, IT, has transformed healthcare around the world. But we also must continue looking at how IT is implemented and designed. For example, digital ordering of tests today. Is it faster, easier than ticking boxes and signing a piece of paper? If it isn't, we must ask ourselves why and how can it be improved? Electronic records today, do they speed things up so that healthcare workers can spend more time, more quality time with patients? Or is there still room for improvement? And if so, why? And how can we make it better? Computer workstations today, the design of workstations today, computers, do they help doctors and nurses maintain eye contact with the patient, comfort the patient, especially in a world with COVID where everyone's wearing a mask and that eye contact becomes even more important? Does it help that eye contact happen? Or is it sometimes a different experience? And if so, why? And how can we make it better? So I asked the ministry, has MOH done any recent studies on the design of healthcare facilities, healthcare IT, and the patient experience? Some designers talk about time movement studies. How much time it takes to get a task done? How much movement is needed to make something happen? Has there been any recent ergonomic research to see what brings more comfort to patients, better performance for healthcare workers? Sir, these studies may not be easy to do, but what we don't study, what we don't look at, what we don't search for, we don't know. We must seek truth from facts. Sir, Steve Jobs was co-founder of Apple and well known for his sense of design and aesthetics. Every iPhone user, everyone who uses a modern multi-touch smartphone sees the impact of his influence and legacy on industrial design. His younger sister Mona wrote in the New York Times shortly after he passed away. She wrote about how Steve Jobs, from his hospital bed as a patient battling terminal cancer, wanted to make the hospital better. Sketching devices to hold an iPad in a hospital bed, designing new fluid monitors and X-ray equipment, redrawing the design of a hospital unit. Now, not every one of us can be Steve Jobs, but every patient brings an important perspective to the healthcare journey. And when we see better through the eyes of our patients, when we see better through the eyes of our healthcare workers on the ground, we continually see better and better ways to improve our healthcare system. We can apply the same care and attention and passion to reimagining the design of healthcare facilities, reimagining the user experience so healthcare workers can do the job even better, care for patients even better, whether it's a hospital computer system, the healthcare workplace, or the patient journey, seeing through the eyes of our people. Sir, I want to speak about our healthcare frontliners. In particular, I want to salute our nurses and allied health workers. Every doctor knows this instinctively, even before they become a doctor, from their days as a medical student. The impact our nurses have lifting up the lives of our patients, making a difference for every patient. Every patient, every caregiver understands this too. And I say this both as a doctor and as the son of a patient. We see the impact that our nurses have, that care, that dedication, that heart. Nursing is also deeply skilled work and essential work. Last year, during the debate on the President's address, I called upon MOH to look at paying our nurses and allied health workers more. And I'm glad the Finance Minister has announced better salaries for our sisters and brothers in nursing. Some years ago, I attended a healthcare conference. One of the speakers was the president and CEO of the Duke University Hospital in the USA. He's a nurse, trained as an oncology nurse, rose up through the ranks to lead the hospital, to lead an entire healthcare system in the USA. We should continue looking at ways to further empower our nurses in Singapore, to create more opportunities for upskilling and advancement as we all work together to lift up the lives of our patients. So I also want to speak on another group of healthcare frontliners who are key to keeping us safe. These are some of our outsourced healthcare frontline workers. Our hospital cleaners, our healthcare attendants are an integral part of the healthcare workforce. They are integral to the hospital. Facing the COVID risks together, serving on the same front line as medical, nursing, and allied health staff, serving together. Once upon a time, all these brothers and sisters were directly hired by the hospitals and not outsourced. Today, a growing number of cleaners and healthcare attendants have been outsourced. But sir, the rationale for outsourcing hospital cleaners and hospital attendants is not compelling. It is not compelling. First of all, the demand for hospital cleaners, for hospital attendants, it's the same throughout the year. There's no seasonal component involved. It doesn't vary much throughout the year. And in a COVID world, it makes sense for team members to stay based within the same healthcare institution rather than moving from place to place amidst the pandemic. We're already providing outsourced cleaners with protective gear during COVID. It recognizes they are part of the same healthcare frontline. And there's something to be said for treating all our hospital cleaners and healthcare attendants as part of the in-house staff, making them feel more fully like part of the team, supporting, resourcing, uplifting these workers together accordingly. Because, sir, when we're fighting on the COVID frontline, we're all in this together. We should think of our hospital cleaners, our hospital attendants as part of the whole healthcare team and not as a service to be outsourced. Furthermore, sir, direct hiring also makes it easier for hospitals to create additional jobs and job opportunities to hire directly from the community nearby. In my Meet the People sessions in Clementi, I've met older workers who've been retrenched, who are looking for job placements in healthcare institutions nearby. And we should look at ways for hospitals to generate employment for residents living nearby as well. I call upon the ministry to consider this outsourcing issue as one of the issues which COVID is forcing societies around the world to rethink. Chairman, healthcare is about health and care, supporting our patients, supporting our caregivers, supporting our healthcare workers, our sisters and brothers on the healthcare front line. It is about keeping all of us safe, keeping us all of us safe together. And so may we continue building a healthier Singapore as we fight this COVID pandemic, as we emerge from the COVID pandemic together. Thank you very much.